For Medical Monday, Dr. Sean Hannigan is here with Bay Care Clinic. We are talking rotator cuff injuries. Let's talk about what this is first of all.
Sure. The rotator cuff is a group of tendons that surround your shoulder joint.
Okay.
So these muscles arise off of the shoulder blade and they surround the upper part of the humerus bone, which is your upper arm bone. And those tendons kind of compress and keep the ball in the socket and gives your shoulder strength and functional ability.
Okay, so when you tear this, how does it happen? I mean, most of the time we're thinking sports injuries, but that's not always the case.
No, so rotator cuff problems do occur more commonly in people who use their arms over, who do a lot of heavy lifting, pushing, pulling, construction workers and such.
Okay, and then like you all said too, sometimes it's just wear and tear.
Yeah, so the incidence of rotator cuff tears increase over time. So it's a very uncommon in your 20s, becomes a little bit more common in your 30s, and becomes almost more common than not when you get into your 60s and 70s.
Wow. Okay, so now that we have this, you might not even know that you have an injury for a really long time. You may go for a while with this, right?
Yeah, many times these types of rotator cuff problems occur very slowly and gradually over time, and it might show up as, you know, a little ache with more heavy or strenuous activities. And over time, you become more aware of that discomfort or ache with everyday activities. And many people finally present when the pain is such that it affects their ability to work or do recreational activities or sleeping. Sleeping's a big issue.
We're seeing some of these symptoms on here. I mean, it's everyday things, the pain while sleeping, the weakness. And I thought this one was interesting, the difficulty while combing your hair, but like you said, that's just an everyday activity and you really start to notice.
Yeah, your rotator cuff has a lot of critical functions, especially with use of your arm away from your body. So anything overhead, away from your body, reaching in the back seat of your vehicle, any of those things at all can become.
You notice.
Yeah.
All right, so let's talk about surgery if you need it. You know, what does it entail?
Well, the treatment usually starts with non-surgical, but if you get to the point where surgery,